Since we're talking about toxicities, I think it's very relevant to mention that T-DXd does have side effects mostly associated with chemotherapy, such as nausea, fatigue, but the number one side effect that is mentioned whenever you talk of T-DXd, for a good reason, is interstitial lung disease.
Yep.
We know that about 10 to 15% of patients, depending on the trial, experience any grade interstitial lung disease. About 1% or less can experience fatal or life-threatening interstitial lung disease. So I think that's the number one side effect that you fear when you give this drug for a long time. We know that the median time of onset of ILD is about 5 to 6 months,
Yep.
but even after 1 year, you can see ILD.
Still.
So I think the benefit of this drug is undeniable. It's an extremely active drug, and this is why you want patients to stay on this
Yep.
drug and to capture ILD as early as possible, to stop the drug and give steroids. And to do so, patients need to be followed with CT scans of the chest every 6 to 9 weeks, ideally,
Yep.
in order to capture ILD when it's grade 1, asymptomatic, so that you stop the drug and give steroids.
No, that's a very good point. Catch it early. You know, coming to this, you published a paper about how to catch it, like survey for it and treat it. Can you go over those 5 features?
Yeah, this was a commentary to a review article, basically. And while I was writing it, I kind of realized that the 5 key points to remember how to manage interstitial lung disease basically all start with S.
Yeah,
and the first
S's.
one is screen. Screen meaning understanding the profile of the patient. If the patient has major lung or kidney comorbidities, both of them can raise the risk. If they had prior ILD, so understanding who you're treating and if it's a frail patient. In such patients, you may wanna be even more careful and scan very frequently. The second word is, of course, scan. Scanning patients every 6 to 9 weeks with CT scan of high resolution of the chest, extremely important.
Yeah.
And then you have synergy with radiologists. Whenever there is any doubt of an ILD, review the scans with radiologists and pulmonologists. Especially for symptomatic cases, we need their help to manage patients. The fourth S is steroids. It's fundamental to utilize steroids for these patients for any grade. And grade 1, you can think of 0.5 mg per kg of prednisone or equivalent, and 1 mg per kg for higher for grade 2 and 3. But in truth, a key point, I think, is the last S, that is stop.
Yep.
Or suspend. Whenever there is any suspect of an ILD, stop T-DXd, do additional inquiries, exams to understand if there is an ILD, and give steroids. So the 5 S's, I hope, can help to memorize.
The 5 S's. People, remember the 5 S's. Really, really helpful in the day-to-day clinic.